Good morning, everybody. Thank you for attending our first press conference for this year. And it's on a very, very important issue. So today, Minister and team will outline a strategy on how we will achieve FMD-free status with vaccination. We will also have a presentation from Dr. Emily Mogayana, who is the head of the ministerial task team. But we will first start with Minister to give an address. And with Minister today, accompanying him is Dr. Matinga, Dr. Morisani, Dr. Mogayana, and then also our DG, Mr. Muketsa Ramasodi. Minister, over to you.
Thank you very much, Joylene, and good morning to all of you, and greetings to the colleagues that have joined us today. And greetings to all of those who are watching online, our social partners, but perhaps most importantly, our farmers. Today, I want to address you with a clear roadmap for the protection of our national livestock herd, as well as the restoration of South Africa's international standing in the agricultural sector. Since losing our FMD-free status in 2019, our farmers have continued to face unprecedented challenges. Over the course of the last few months, I've received many pleas for help from both commercial as well as communal farmers. And it is our farmers who have borne the heavy burden of the recent FMD outbreaks in the country. We see your struggles. We understand and acknowledge the financial as well as emotional toll that outbreaks like foot and mouth disease have on you, on your families, and also your livelihoods. We remain deeply sympathetic to the hardships that you have endured. However, I do want to give you the assurance today that we have a plan that is both realistically achievable as well as being technically sound. I want to be honest and upfront with the nation. Achieving FMD-free status is a monumental task that is not going to happen overnight. It is a process, it is not an event. Our strategy that will be dealt with today by Dr. Magajani will be a strategy phased over 10 years. It will be phased in various different phases, starting with stabilization, moving to consolidation, before moving eventually to the removal of vaccination and a final recognition of freedom without vaccination by the World Organization for Animal Health. This is a long-term commitment to the health of our economy and security of our food supply and protection of our farmers. I need to emphasize upfront, vaccination is not a silver bullet to eradicate or manage this disease. It is merely one of the tools that can and must be used to combat foot and mouth disease. It is, however, no replacement for good on-farm biosecurity, a greater adherence to movement controls, as well as ensuring at a farm level that biosecurity is up to the correct standards. FMD is not magically spread. It is spread through the movement of infected animals. That is how the disease is spread. And so, although we'll be embarking upon a mass vaccination of the entire national herd, this cannot be a substitute for practices that must remain in place. At the AFASA Leadership Conference in November, I announced the initiative of vaccinating the national herd, starting, of course, with those areas where the biggest and most severe cases of FMD have occurred. Those areas are identified through a scientific process also referred to as a heat map. And that is why it is absolutely essential that outbreaks, wherever they may be, are reported. It is concerning to note that there are outbreaks taking place that are not being reported. What this does is ensures that we are then unable to know where the biggest areas of concern are and to intervene. The Ministerial Advisory Task Team on Animal Disease, post my announcement in November, led by Dr. Emily Mogajani, was tasked then with translating our vision of FMD free through vaccination into a high impact and actionable strategy. The Ministerial Task Team brought together the nation's foremost authorities in veterinary science, biosecurity, policy, and livestock management to ensure a resilient and secure agricultural economy. Representing the government is Dr. Emily Mogajani, the Chief Director of Biosecurity Coordination, and she is the chairperson. Dr. Modasani, the Chief Director of Animal Health and Production at the Department of Agriculture. Dr. Nomsa Mnisi, the Director of Biosecurity Support Services at the Department of Agriculture. Dr. Temba Sekakane, the Chief Director of Veterinary Services in KwaZulu-Natal. Dr. Beki Klele, Chief Director of Veterinary Services in Mpumalanga. Dr. Winton Rabalau, Director of Veterinary Services Gauteng. Dr. Baratang Lubisi, the Research Team Manager at the Agricultural Research Council. Dr. Moses Mabunda, the Director of Veterinary Services in Limpopo. Dr. Marietta Swanepoel, the Deputy Director of Secretariat Support. Dr. Oseke Ngoveni, the State Secretariat Support. And because, although this is a state-controlled disease, there is a very clear understanding that the state alone cannot resolve the problem. And that was the reason that we created a task team that included the private sector. And we have been very blessed to have the services of the following specialists who provided technical depth across the entire value chain. This is Professor Dietmar Holm, University of Pretoria, Bovine Herd Health. Dr. Dirk Verwoerd, Specialist in Infectious Diseases of Intensive Production Systems, with an emphasis on vaccine development, surveillance and diagnostics. Dr. Jacques Marais, who's represented the dairy industry. Dr. Anthony Davis, who's represented milk processors. Dr. Adrian Olivier from the ostrich industry. Dr. Amanda Boertes, a specialist in FMD and African swine fever diagnostics, as well as molecular epidemiology. Dr. Mark Chimes, the dairy sector, who's the chairperson of the Brucellosis and Tuberculosis Steering Committee. Dr. Peter Evans, who's the specialist in the eradication of PRRS and African swine fever outbreak management. Dr. Sean Morris, a leading feedlot specialist. Dr. Bati Dungu, member of WOHA Scientific Commission, and also part of the African Union Veterinary Vaccine Center. Dr. Dani Odendaal, who's a ruminant veterinarian specialist. Dr. Gerhard Neetling, who's an export and abattoir specialist. Dr. Francois Marie, specialist in vaccine design, testing and diagnostics. And Dr. Livio Heath, the diagnostics, epidemiology and international trade relations. To maintain transparency and cross-sector alignment, this task team reports directly to the value chain roundtables in the AAMP. This structure ensures that every stakeholder, from local producers to international trade partners, is represented in this task team. The strategy that we're employing, and which Dr. Mogajani will take us through, is not a temporary patch. It is a comprehensive control and eradication program designed to interrupt virus transmission and to protect our national herd. It is important to emphasize at this point that the success or otherwise of the strategy will strongly rely on the urgent review of the legislative framework that has to be adapted now to what is an evolving emergency situation. Our plan is built on world-class technical principles. The first part is targeted vaccination. We will obviously be prioritizing the high-risk zones. We know that KZN is the epicenter, but many other provinces are also suffering. The goal there is of reaching at least 80% coverage in targeted cattle populations, especially in the communal areas, and up to 100% of feedlots and dairy cows. The objective is to, within 12 months, reduce outbreaks incident by 70% in the high-risk provinces through systematic vaccination, and then to preserve FMD-free provinces through buffer vaccinations and strict movement controls. High-quality vaccines with high potency will be used during the campaign, especially trivalent vaccines of SAT1, 2 and 3 that are currently circulating in South Africa. We have, over the course of the last month, been engaging with a variety of vaccine manufacturers around the world, and partnerships with leaders like Biogenesis Bago in Argentina can ensure that we can have a ready and reliable supply with 1 million doses ready to be sent as soon as the necessary permits are issued. The company indicated that as soon as the permits are issued, they're able to supply the vaccine in the coming fortnight. We are currently preparing the application for authorization by the South African Health Products Regulatory Authority, SAHPRA. Because many of these are unregistered medicines here at the time, there's a notion out there that the department is able to just sign off on the importation of vaccines at its will. When it is not a registered vaccine in the country, we have to use Section 21 of the Act. As it relates to the Bago Biogenesis vaccine from Argentina, which proved particularly effective in South America's eradication of foot and mouth disease, and culminated in their, and particularly Brazil being declared FMD-free without vaccination during the course of last year, we are following this path. That application will be filed by Monday, and Biogenesis will also be able to supply an additional 5 million doses by March 2026. Since the outbreak, many of you are aware that we've been procuring vaccine from the Botswana Vaccine Institute, and we will continue to source vaccine from the Institute. The idea is to authorize a number of vaccines so that we have a constant stream of supply coming into South Africa. The BVI and the ARC will look into the existing memorandum and complement one another to ensure that we reach maximum vaccine coverage. Last year, we received confirmation from BVI that they can supply us with 1 million doses per month. Unfortunately, due to cleaning processes, mandatory cleaning processes, they were not able to deliver that on time, but the delegation of Botswana was in South Africa yesterday, and they have confirmed that they have the bulk antigen of SAT2, and this bulk antigen will be formulated to produce SAT2 vaccine to be used in areas where SAT2 is prevalent. It's also important to announce that we've also secured now from SAHPRA the necessary permit to import the Dolvet vaccine from Turkey. It is very important that we understand as well that locally we are activating a local production line through the ARC and OBP, which will initially produce 20,000 doses per week, scaling up to a capacity of 960,000 doses. The ARC indicated on Monday that they can bring forward their production, and we're grateful for that, CEO, which will add 12,000 doses to our vaccine pool by mid-February. That is in line with what's coming in from BVI, what will come in from Biogenesis, and what will come in from the Dolvet. I want to now deal with the issue of the Pirbright Institute. Many calls have been made, and I've noticed on social media people making videos and the like, under the assumption that we have not sent our latest strains to the Pirbright Institute. However, I can confirm that we've instructed the ARC to send the field strains to Pirbright. This was done during the course of last year as a matter of urgency. The ARC has confirmed that they are preparing the strains to the correct formulation in order to send to the Institute. What this will mean is that all FMD vaccines used in South Africa will have the full antigenic matching at Pirbright against South Africa's current field strains to allow the comparison of the various vaccines. What this will do is allow South Africa to select the very best vaccines to contribute then to the control of this devastating disease. A vaccination program is one tool, but a vaccination program has to go hand in hand with enhanced surveillance and movement control. If we just vaccinate and we don't have proper surveillance, there really is no point, because we will never then be able to reach the point where we can determine when to stop vaccinating, and we will never reach the ultimate goal, which is to get us to FMD-free status without vaccination. We are strengthening the laboratory network led by the Agriculture Research Council, Honest to Port Veterinary Research, and they will work with existing state laboratories to ensure that results are received timelessly. We've already started with increasing capacity at OVR, and we will also implement, together in partnership with the industry, a digital livestock and traceability system to ensure that animal movements are safe and tracked, and other simplified mechanisms will be looked into. We are currently working with the Council for Scientific and Industrial Research and the RMAS traceability platform to implement the livestock identification and traceability system, which will enhance our traceability. And we are grateful for the partnership with the RMIS, who have played an absolutely stellar role in coming up with a strategy and helping us to combat this particular outbreak. We're also lucky that with the integration of advanced technology, we're no longer fighting this disease in the dark. Through the RMIS Operational Center, we now utilize a real-time digital heat map to track verified cases and suspected outbreaks within a 10-kilometer radius. This work is done together with the epidemiologists using resources from the equine industry. Turning to surveillance, there's also again been a number of social media videos made about why we don't just give this to everybody to vaccinate their own herds. The reality is that we need to maintain the strongest levels of surveillance. There are incentives for people to vaccinate and then not report that they've vaccinated those animals. And it is important that the vaccination program is conducted by state vets, animal health technicians, in partnership with the private veterinary services to ensure that we are able to surveil every vaccinated animal and to be able to follow up where we are at in this particular process at any given time. What that will also do is ensure that we are being able to be held accountable to the targets and milestones that we have set. It's important to note that the current outbreak started in 2021 when animals were moved from Phalaborwa to KwaZulu-Natal. The Northern Cape is currently the only province that has not reported an outbreak of FMD. I think it's also important to say that over the course of the last few months, we have vaccinated almost 2 million animals since the recent outbreak occurs, through vaccines procured through government. The details of the outbreaks are as follows. The SAT2 FMD outbreak in KwaZulu-Natal, in Mpumalanga, Northwest, Gauteng and Free State. There's a SAT1 FMD outbreak in KwaZulu-Natal. There's a SAT3 FMD and SAT2 FMD outbreak in the Eastern Cape. The Western Cape reported one outbreak, and there's targeted active surveillance which commenced in May 2025. Limpopo, after having achieved FMD-free status, has had SAT3 FMD outbreaks on 8 properties in 2021, and recently they had 3 outbreaks. I want to turn the focus now to the actions that we will take. Interventions in those provinces will include the immediate mass vaccination across affected areas. That will then be repeated within 3 months. 100% vaccination of feedlots and dairy cows, 90% of commercial and 80% of communal animals. Areas where recurring infections occur, like the parts of Mpumalanga and Limpopo, where buffalo farming has increased, there will be biannual campaigns to be launched at these border hotspots, and vaccination will continue in the protection zone. In that regard, I'm very pleased to be working closely with Minister Willie Oukamp, who is with us today, who is the Minister of the Department of Forestry, Fisheries and Environment, and who will be working closely with the Department of Agriculture to assist us, particularly as it relates to wild animal populations. Biannual campaigns will also then be rolled out in Nkomazi and Bushbuck Ridge, with a vaccination of 85% of the communal and 90% of the commercial animals. Joint wildlife surveillance and targeted vaccination near reserves, again in cooperation with Minister Oakam's department, will also be implemented. In the Eastern Cape, biannual vaccination will take place in the hotspot areas, and the establishment of a protection zone will be implemented. In addition, we will be providing capacity to increase surveillance in markets and slaughterhouses. So the reality is that the success of the strategy that will be outlined relies on the cooperation of every citizen. And we need our farmers to work hand in hand with state veterinarians to report immediately clinical signs and to strictly adhere to movement controls. The disease is spread when infected animals are moved in disregard to the existing protocols and biosecurity regulations and infect other animals. I want to make it very clear that this detailed plan, will be shared firstly with MECs and provincial veterinarians, cabinet ministers and industry leaders. A cabinet memo is being prepared for the first cabinet meetings of this year, where we'll be approaching national government to declare FMD a state of disaster, and what we hope that will do will allow us then to be able to, through the NAT joints system, be able to then get greater cooperation from the SAPS, municipal traffic departments, provincial traffic departments, and perhaps even the SANDF to assist us with ensuring that movement controls are dealt with. We understand, of course, the constraints that these agencies all have, but we do require them, because the Department of Agriculture does not have its own internal policing system, and we need the relevant authorities to assist us with manning roadblocks and ensuring that a very strong message is sent out that the undocumented movement of animals has to come to an end. Again, the disease is spread through infected animals being moved into areas where they contaminate non-infected animals. That is how FMD is spread. I believe that we need the private sector, we need farmers, farm workers, and veterinarians to work together with government to ensure the implementation of the plan is executed countrywide. By protecting our national herd, we are in fact protecting our future. As I said in Parliament yesterday, our strategy is to wage war against FMD with all the tools that we have available to us. To wage it in feedlots, to wage it in dairies, to wage it in communal areas. That is the strategy, and we need your patience, partnership, and unwavering support as we implement this scientifically backed plan to restore South Africa to its rightful place as a leader in global livestock trade. Together, working together, I believe that we can ensure a resilient and FMD-free South Africa. I'd now like to hand over to Dr. Emily Mogajani, who will take you through the strategy and the plan. Thank you. Over to you, Doc.
Thank you, Minister.
Doc, let's just see if Justice is ready. Justice, are you ready?
Thank you, Minister. Thank you, DG and the CEO of RRC, Dr. Lita. Members of the media, we are here to present to you the strategy for the country, because we believe that, when I say we, I'm talking about the task team which was highlighted by the Minister, and we believe that we can do it if we work together. Now, on the vaccination strategy, I will be going through the slides, and I want to indicate that we're working very hard, and I think this second slide which is actually giving you the details of the can I request them to synchronize that? Yes, the second slide which talks about the background, I will not dwell into that. By now you should be knowing that in South Africa we've got SAT1, SAT2, SAT3 as mentioned by the Minister. But we have noticed the FMD, these SAT viruses are very and exhibit severe clinical signs in dairy cattle. South Africa lost its foot and mouth disease freedom in 2019. The current outbreak started in 2021, 2022, as the Minister mentioned, and it moved from the area in Phalaborwa coming down to KwaZulu-Natal. The viruses which are circulating currently, we find SAT2 in KwaZulu-Natal, Mpumalanga, Northwest, Gauteng, and Free State. And we're mentioning this because we've got all available vaccines in the world which are not typical of the Southern African types. And the Southern African types, you find that buffaloes, they are the ones which are carriers of the disease, and buffaloes in the country, they don't exhibit clinical signs. They are reservoirs of the disease. So it's quite important when we deal with foot and mouth disease, and we talk also about surveillance program which ought to be implemented among buffaloes. We had SAT1 FMD outbreak in KwaZulu-Natal, and we had SAT3 outbreak in the Eastern Cape. The Eastern Cape, they had this outbreak. They managed, it was in the human stop area, and they managed to contain the disease. So far, they have not reported any outbreak of the disease. So they can be, in inverted commas, say they are free because, as like we are saying, for the Northern Cape and the Western Cape. The upgrade even in Eastern Cape, and it's continuing. In the Western Cape, the Western Cape province, they only reported one outbreak of disease, and it was as a result of movement of animals from one area into the Western Cape. Animals were traced back, and we realized that a truck moved from the northwest to go to the Western Cape. Limpopo province, they recently had 3 outbreaks reported. This map, as you know, is a map, the current map, which is actually known, which is known. We remember that the Kruger National Park, it was regarded as an infected area with the whole of South Africa free from foot and mouth. But now we have a situation where we've been having outbreaks in this particular area. I'll show you the next map, which shows basically that the infection is actually distributed in this particular area, which is the Northwest, Free State, Mpumalanga, and KwaZulu-Natal. The biggest challenge of KwaZulu-Natal is very endemic in the province, and our aim in the strategy is to ensure that we're able to vaccinate all animals in KwaZulu-Natal. I think the circles here show you the infection, which is actually there in the northwest, and it doesn't help to control the disease in one province and forget the other province. The classification system, which I'm going to share with you, was based on the livestock statistics existing currently. I think we're estimating about 13 to 14 million cattle in the country, and in particular, what we did was to actually zoom into the provinces, into the district, to try and check the livestock statistics in each particular province. Our mass vaccination program, we are saying we are going to follow a risk-based vaccination strategy. You'll see in another slide where I explain different provinces and the risks which are there. We're only not going to focus on the risk-based strategy, the vaccination strategy, but also strengthening the diagnostic capacity in the laboratory network, a comprehensive surveillance program, movement control measures, trade support mechanisms, and ensuring that we support also the communal system, because it doesn't help us to actually just deal with one sector of the population, but we have to really vaccinate all the population within the commercial sector and the communal sector. We are continuing to do a progressive zoning and compartmentalization, and will be able to contain the disease. The strategy, the aim is to try and make sure that we interrupt the virus transmission based on the data which we have, which is advised by our epidemiologists. Will be interrupt the virus transmission, we reduce the incidence of the disease to very low levels in 2 to 3 years. We are saying we create a certified FMD-free zones with vaccination and pilot the compartments of trade, because within the World Organization of Animal Health, there's that allowance where we can create compartments and ensure that those compartments which are regarded as free from disease, they can engage in trade. We are also going to ensure that in our strategy, we said we divided into phases. Our phase 1 is going to be intensive vaccination. We start from the epicenter, KwaZulu-Natal, Gauteng, Northwest. Intensive vaccination, strengthening the surveillance program which is in place, ensuring that we are able to provide evidence in terms of measures which have been put in place. Enhanced movement control and laboratory capacity reinforcement. I remember that when you talked about enhanced movement control, we were saying that I think it's quite important that we limit the congregation of animals. You know very well that when you go into a taxi, in a car, and somebody is having a flu, when you arrive at home also you'll be having some symptoms. Even animals that are congregated in one place, it becomes a chance, it's got a high chance of actually getting the infection. Our phase 2, we are saying that it will focus mainly, phase 2 will focus mainly establishing buffer zones and compartments. Buffer zones are those areas which will center around areas like Northern Cape, Western Cape, and also the Eastern Cape province.